Hi friends, welcome back to the channel. So as the resident doctors across the country are protesting against the delay in NEET PG counselling, today I want to address a very important issue on this channel. An issue that every resident doctor faces in his career, that is burnout. And burnout is one of the reasons that this nationwide strike is happening currently. So after completing MBBS, doctors in India sit for an exam called as the NEET PG exam, which lets them specialize in a particular field. Lakhs of doctors compete for 45,000 or so postgraduate seats, which lets them enter the healthcare services and provide their services and learn new skills for a particular specialty. These thousands and lakhs of doctors are just sitting at home waiting for admission. While those who could not clear the exam this year, they are preparing for the exam next year in March 2022. Can you imagine how big that number is? It's a huge pool of doctors who are just waiting, sitting at home doing nothing while they can provide their services for the country in the time of a pandemic. These doctors are just waiting for a crumpled healthcare system to help them move ahead in their career. Did they do anything wrong? No. They cleared the exam they were supposed to, they studied for it, they cleared it, but still they're sitting at home doing nothing. And while the resident doctors who are working in the hospital are overburdened with the patient load, and then we cry about shortage of doctors in India. So the problem is the NEET PG 2021 exam, which was supposed to happen on 6th January 2021, got postponed twice, happened in September. And then the counselling got postponed again and again due to some reservation issues for economically weaker sections. And now the matter is sub judice, the counselling is just not happening. The Supreme Court says the next hearing date will be 6th January 2022. That's exactly 1 year after the exam was supposed to happen originally. All this time, the hospitals are running with 2/3 of the manpower of residents. And very soon, this manpower and the strength of residents will reduce to 1/3 when the final year students will go for their exams. 1/3 of resident doctors. And the third wave of COVID is looming large at us, and our authorities are saying they are prepared to fight COVID. Imagine what the doctors are going through. Workload, especially in a government hospital, running in full strength of doctors is so much that the doctors have to work for more than 36 hours at a stretch. They work for more than 80 to 90 hours per week. And with such a workload, the hospitals for the past 6 months or so have been running with 2/3 of the manpower. The number of patients is not decreasing. They are increasing every day. Doctors in such a situation are like a hot furnace waiting to explode. I very well remember my junior residency days when I almost vomited in the middle of an emergency room one day because the number of patients was so much and so many patients were critical, and I got so stressed that day that I almost vomited in the middle of the emergency room. Most resident doctors are in the age group of 25 to 35 after completing their MBBS. Some of them have newborn babies waiting at home. Some of them are just married and they are starting a new life. Life of a resident doctor in India is miserable to say the least. But the system still manages to surprise us by not bothering at all about a whole academic year being lost. Resident doctors, apart from treating patients, are supposed to do research and thesis and bring new advances in healthcare. Those resident doctors are not getting time to eat properly. And you can imagine the quality of care the patient will get if the resident doctors burn out. The resident doctors across the country had to take this drastic step of withdrawing their services because there was no way out. Burnout among resident doctors is real, and for the past 6 months, the doctors are under tremendous stress. Running overburdened tertiary hospitals with less manpower of residents is just inhuman to the junior most doctors. I have given the NEET PG exam, I have given the NEET super specialty exam, I have done 3 years of junior residency, 2 years of senior residency before I started doing MCH, and I have the first-hand experience of all this. Resident doctors are not asking for too much. I hope this video was helpful for you to have a reality check of the situation and why the nationwide protest is happening, and I hope with time things will improve further. My name is Chisel, you are watching The Tech Doctor. Namaste.